Hello friends, welcome back to Dental Exam Guide, and today we are going to learn about the mechanism of eruptive movement or the theories of tooth eruption. Actually, the exact mechanism of tooth eruption is still it is a controversy, and there is no consistent understanding of cause behind the tooth eruption. And majority of the studies agree that tooth eruption is a multifactorial process. And this is an important topic because as a dentist, you must know the etiology behind the eruption and you should be able to explain the mechanism of tooth eruption because it's essential to perform etiology based treatment. Then it will be easy for us to find out the abnormalities that can occur during the course of eruption. So once we recognize during which stage of tooth eruption the abnormality have happened, we can plan the treatment in a proper way. So let's move to the mechanism of eruptive movements or the theories of tooth eruption. The exact mechanism of tooth eruption is still a matter of controversy, and majority of the studies agree that eruption is a multifactorial process in which cause and effect are difficult to separate. Four theories of mechanism of tooth eruption have been put forward and accepted. These include root formation theory, hydrostatic pressure theory, selective deposition and resorption of bone around the roots or the bone remodeling theory, and the periodontal ligament traction theory. First one is root formation theory. According to this, it is the formation of root and increase in the length of the root that cause the occlusal movement of the crown. It proposed that the space for the growing root it is compensated by or it is accommodated by occlusal movement of a tooth crown. As per this theory, there is some structure at the base of the socket which transmit the forces exerted by lengthening of the root in the occlusal direction rather than causing the resorption of bone at the apex. So this theory says in brief, the lengthening of root of a tooth is not causing any resorption of bone just apical to the root tip. Instead, some structure which is present over there, it is causing this force to get transmitted in the opposite direction, that is towards the occlusal aspect, and it is the force with which tooth is erupting. And if we try to apply this theory, one point of importance is that the tissue beneath the growing root it is really resisting the apical movement of developing root. Studies have proved it, and this resistance results in the occlusal movement of tooth crown as the root lengthens. But the facts that refuted this hypothesis are rootless teeth still erupts, and some teeth erupt more than the total length of roots, and the teeth still erupt after completion of root formation. And also some teeth with extensive root development, they fail to erupt. And studies have showed that root formation produce a force which cause bone resorption by osteoclast. But we cannot reject this theory completely because recent studies have showed that during the intraosseous stage of eruptive phase, root formation and jaw growth lead to compressive coronal hydrostatic stress. That is, the formation of root and the growth of the jaw is causing some kind of stress towards the coronal direction. And this stress which is applied towards the coronal or crown direction, it is causing the dental follicle and the stellate reticulum cells of the developing tooth to secrete some mediators which helps in the resorption of the bone which covers the crown portion of the tooth. This in turn will facilitate the eruption of the tooth. So we cannot tell that root formation is not having any role in the eruption of a tooth, even though we could not accept every postulates of this theory. Next theory is a hydrostatic pressure theory, vascular pressure theory, or a blood vessel test. A number of studies exist to demonstrate that there is a hydrostatic pressure difference between the tissue around the erupting crown and its apical extent. And this theory suggests that a local increase in the tissue fluid pressure in the periapical region is sufficient to move the tooth. And this hydrostatic theory was investigated by Hazel and McMinn, who demonstrated that the tissue pressure apically was greater than occlusally, which theoretically generate an eruptive force. But no association was found between the rate of eruption and the pressure gradient. And this theory is again debatable because root excision and the local vasculature excision does not prevent the tooth eruption. But this theory also is not completely rejected because recently it is reported that hydrostatic pressure theory can be applied during the post-emergent eruption. Because during post-emergent tooth eruption, dental follicle is secreting some mediators such as vascular endothelial growth factors, which is causing the angiogenesis with the formation of blood vessels, and there is an increase in the apical tissue pressure, which in turn lead to the tooth eruption. And hydrostatic pressure theory was supported by several studies that confirms the tooth eruption after local injection of vasodilators, whereas injection of vasoconstrictor causes decrease in the rate of eruption. Next theory is the bone remodeling theory. Bone remodeling is a selective deposition and resorption of the bone. That is, if there is a resorption of bone from one side, there will be the deposition of equal amount of bone on the opposite side. That is called as remodeling. And during the process of tooth eruption, bone resorption occurs coronally and bone apposition or the deposition occurs apically. And bone remodeling theory suggests that this inherent growth pattern of the maxilla and mandible supposedly move the tooth by selective deposition and resorption of this bone. And it's not sure if bone remodeling play a significant role in the tooth eruption, but definitely it is involved in the process of tooth eruption. And the strongest evidence in support of bone remodeling as a cause of tooth movement, it comes from a series of experiments in dogs. And recent studies also shows that mutation of parathyroid hormone receptor gene, which is associated with the bone remodeling, can cause or it can lead to a condition called as primary failure of eruption. So since this gene is mutated, there is some disturbance in the bone remodeling and it is leading to the condition known as primary failure of eruption. So we can see bone remodeling is playing some role in the eruption of tooth. Next theory is periodontal ligament traction theory, and it is the most accepted theory. And this theory states that formation and renewal of periodontal ligament has been considered as a factor in the tooth eruption because of the tractional power of the fibroblast. According to this theory, due to the contraction of the fibroblast, which are situated in the periodontal ligament, a pressure is created which favors the eruption. A lot of evidence suggests that the eruptive movement is brought about by the dental follicle periodontal ligament complex. Here, a contractile force is exerted by periodontal ligament fibroblast, and this force is transmitted to properly oriented collagen fiber bundles. And summation of these contractile force causes a tooth movement. And it also says that the bone remodeling that is necessary for forming the eruptive pathway is facilitated by cell of a dental follicle. So based on this theory, PDL dental follicle complex possesses some eruptive force due to the traction power that the fibroblasts have. There is one more theory called dental follicle theory, which postulates that dental follicle is capable of inducing bone resorption above the developing crown and bone apposition below it, and this enables the formation of an eruption path through which the tooth will be conducted. There was one more theory called cushion hammock theory, which was proposed by Harry Seashore. He assumed that a ligament called cushion hammock ligament is present below the tooth and it is responsible for the tooth eruption. But later it was proved that the ligament described by Seashore was an artifact in the slide preparation and there is nothing called a cushion hammock ligament exists. So this theory was rejected. Recently, molecular studies have revealed that eruption is regulated by inductive signals between dental follicle, reduced enamel epithelium, stellate reticulum, and alveolar bone. Reduced enamel epithelium is the epithelial covering of the enamel after its formation is completed. Dental follicle is a loose ectomesenchyme derived connective tissue sac which surrounds the enamel organ and the dental papilla of a developing tooth germ. And stellate reticulum is a star-shaped group of cells located at the center of enamel organ of a developing tooth. So recent studies have revealed that eruption is regulated by some signals between these structures, that is dental follicle, reduced enamel epithelium, stellate reticulum and alveolar bone. And regional differences in the dental follicles were described. It suggests that coronal aspect of the dental follicle regulate osteoclastogenesis or bone resorption and the basal part regulate osteogenesis or the bone formation. This is how they form a eruptive path. And some recently proposed theories are bite forces sensed by soft dental follicle theory. This theory postulates that follicular soft tissue can detect the bite forces, and this bite forces is the one which direct the bone remodeling, which in turn will enable the tooth eruption. Next theory which was proposed recently is innervation provoked pressure theory, and this theory postulates that root membrane acts as a glandular membrane. So this innervation in this membrane, it causes a pressure in the apical part of tooth which result in the tooth eruption. Third theory is the equilibrium theory, which postulates that after the functional plane is reached, that is, once the tooth reach in a functional place, the eruption of tooth is balanced in response to the growth of the mandible, that is the vertical growth of mandible. Fourth theory is neuromuscular theory or a unification theory, which postulates that synchronized forces of the orofacial muscles under the control of central nervous system are responsible for the active movement of tooth. I'm not going into the details of all these theory because I know it is a bit boring topic. Okay, so to sum up, the tooth eruption must be considered as a stage of tooth development, and each of the eruption theory has a say to some portion of the eruption process, and eruption of the tooth is a multifactorial process. So that's all about today's video, and I will be back with another important topic, the chronology of human dentition, in the next video. Have a nice day.